Okay, this section is entitled Introduction to Regulatory Compliance, and we're going to review these regulatory agencies that might have jurisdiction over your facility. Well, the first one, the most important one, is Cal/OSHA, and that stands for California Occupational Safety and Health Administration. And if you are from different states, then you might be under your own state OSHA program, whatever your state is, or you could be under the federal standard because there are only 26 states in the United States that have their own in-house OSHA program. So you might be under the federal standard, which are basically just as important, even though state-run OSHA programs are a little more stringent, and California happens to be the most stringent. So whatever we're going to be teaching you today is based on California law, and that gives you an edge because if you are California compliant, that means you are good to go with any other state in the union and even overseas. So let's take a look at some of these types of things that OSHA requires. The first and foremost important thing is what is the main focus of Cal/OSHA. And if you're looking at your handout, which you should be using at this time, you want to enter this into your blank right there on your handout as the main focus of Cal/OSHA being safety of employees and their health. This is the concern of Cal/OSHA. And when we're talking about different standards within Cal/OSHA, such as bloodborne pathogen exposure control plan, hazard communication, injury and illness prevention, aerosol transmissible diseases exposure control plan, fire prevention emergency response, and ergonomics, these all focus on safety of employees. And that's very important. Whereas maybe the dental board has their focus on patient safety, or what we call quality of care. So there's a distinct difference between these agencies, and Cal/OSHA is focused on employees. And who is an employee? An employee is someone who gets paid. If you don't get paid and you work at this office or this facility, you are considered a volunteer. You could be an intern, you could be an extern, or simply a volunteer who's helping out, but you're not getting paid. So you yourself, you are not under OSHA jurisdiction. Also, as an owner of this facility, if you are a sole proprietor or a partnership, otherwise not incorporated, then you yourself are exempt from OSHA jurisdiction. However, if you are incorporated, then you become an employee of your own corporation. Some things to know about Cal/OSHA is that, first of all, most common cause of inspections are complaints. These are complaints usually from disgruntled people. That's the number one cause. Additionally, second most common cause would be work-related injuries or illnesses that may happen in a facility that are considered serious. And serious injuries would be something that caused permanent or prolonged impairment of the body or death of an employee. And you would know that, obviously. And of course, the least common is random inspections. And yes, OSHA does random inspections, but it's usually facilities that are 11 or more employees, and hopefully you're under 11. And if you are over 11, that's great. It's not a problem. It's just that you might be randomly inspected. Now, OSHA's inspections are surprise visits. No pre-warnings. Nobody knows they're coming. As a matter of fact, if anyone called you and said, I'm coming tomorrow at 3 o'clock, they're not from OSHA. Now, the other thing that you need to understand is Cal/OSHA inspections cannot be rescheduled unless you have a representative such as a consultant, and certainly we can play that part for you, and we can actually reschedule the appointment a little bit easier than you could. If you try to reschedule the appointment, the OSHA inspector has the right to go and obtain a warrant and be accompanied by the sheriff. Don't want to go there. You want to make sure that you are represented by someone or a company or consulting firm that can actually give good reasons why this appointment should be rescheduled. And that allows you some time to come in, maybe do some pre-inspections, make sure you're ready, have a huddle with the team, because some of your employees will be interviewed by Cal/OSHA and other OSHA agencies, and certainly the federal standards. And you need to be ready for that. And this is important because there's no time to fix anything when you are cited by OSHA. And that means that if they cite you, there's going to be a monetary penalties, and you have to pay. It's almost like seeing the flashing red lights in your rearview mirror. If a police officer pulls you over and you don't have your registration, or it's expired, or you don't have insurance, or your license is suspended, you're going to get a citation, and there'll be always a monetary penalty attached. Same thing as OSHA. Now, in California, maximum fine for a serious violation is $25,000, whereas in other states it might be lower. California happens to be one of the highest. And so if you are a California employer, you need to be extra careful about Cal OSHA. But again, as long as you have certain things done in your facility, you don't need to be worried about Cal OSHA. So let's move on to another agency which is just as important, but maybe not as deadly as Cal OSHA, and that is the Department of Health and Human Services. Now, Health and Human Services is a federal agency, and they have their divisions within each state. In California, they're called California Department of Public Health. Their main focus is public's safety and health versus the employees, right? So public would be, obviously, for the majority, would be patients. They would also be people who come to visit your facilities, such as vendors, workers, people that come to fix things, as well as non-patients that come in to visit you, maybe go out to lunch with you or what have you. If anything happens to anybody while they're in your facility, the Department of Health has jurisdiction over that particular incident. So that's why you need to be careful. They're also the agency that have jurisdiction over privacy of patients, what we call HIPAA, which is the Health Insurance Portability and Accountability Act. So they're the HIPAA police, and the division is called Office of Civil Rights, and these guys are the enforcement division that come and investigate any HIPAA violations, any unauthorized disclosures, or any type of breach that might have happened. And basically, that's something that they do. Now, we have a separate discussion on HIPAA in another video that you're certainly welcome to watch. Let's move on to another division within Department of Health, and that is the Radiological Health Branch. The Radiological Health Branch deals with X-ray equipment, registration, maintenance, and safety. Every time you have an X-ray equipment or buy a new X-ray equipment, it first must be registered with the RHB division, as well as they look for you to maintain this equipment, and that is something that you need to do on a regular basis according to the owner's manual. As a matter of fact, you have to have a copy of the owner's manual on site and be able to show that in an inspection. Safety means that anyone who takes X-rays must be properly educated. If you're a dental office, they have to take a radiation safety course. If you're in a medical facility, they have to have, again, education on radiation safety, and usually they're required to be a radiation technician. And so there's different requirements that you need to be looking at and be prepared for. And if the maintenance requires you to do calibration on an annual basis or whatever, you need to do that. And you need to have documentations that you've performed those things. Also, a lot of people ask me about dosimeters or these X-ray badges that measure radiation during your work. Now, if you work in a dental facility, these badges are available to you upon request. So if you're a female and you'd like to wear one of these X-ray badges, or a male, you can actually request that, and your employer will provide that to you. In medical facilities, the regulations might be a little bit different, but still, it's usually upon request. Depending on what state or what type of facility you're in, the regulations may vary slightly from place to place and facility to facility. And so that's pretty much all we want to say about RHB. The next area that they pay attention to is regulated medical waste and how you handle that within your facility. Now we're going to move to the next agency, which is Environmental Protection Agency. And Environmental Protection Agency deals with nothing but pollution, right? Specifically speaking, water pollution is their main concern. If you're a medical facility, they're concerned about any facility that may pour liquids, chemicals down the drain that you're not supposed to, especially if they're acidic in nature, because they can cause corrosion as well as loosening chemicals from pipes and bringing those chemicals into the water supply. And that's not good, obviously. If you even throw things in the garbage that you're not supposed to, such as medications and other things such as lead or mercury, things that are bloody that you're not supposed to throw in the garbage, those are all contributing factors to pollution of the environment. So there are rules and regulations when it comes to regulated medical waste, as well as how you handle certain types of waste in your facility. If you're a dental office, one of the main things that these guys are very keen and focused on is how you handle amalgam, which has mercury in it, in your facility. Now, you drill out amalgam from old fillings. Even if you don't use amalgam as a filling material, you still drill it out. And these pieces of amalgam from the old fillings are caught at chairside traps and vacuum traps. And you want to make sure that these are treated as amalgam waste, as well as any capsules of amalgam that you've used, or any scrap amalgam, or any extracted teeth with an amalgam filling in it. These are all considered amalgam waste or mercury waste. And so what you need to do in order to handle your mercury waste properly is to purchase a mailback system called an amalgam waste container. And this is a 5-gallon bucket that you can obtain from us or anywhere online. Find the best price and purchase from them. And this allows you to put all your chairside traps and any other amalgam waste that I mentioned inside there. When the unit is filled, when the entire 5-gallon bucket is filled, you place it back into the box that you hopefully saved, and the shipping label you've saved, and then you can mail it out to wherever it's supposed to go. And these are incinerated in a very specific manner, and that's why they're mailed to a specific facility outside of the state. Now, the other things that they are interested in looking at are the fact that you have a sterilization protocol in writing and that's personalized to your facility. Now, we've provided this form to you online. You can download this in a MS or Microsoft Word type format, and then you need to get in there and personalize it. It has instructions in italics that you need to look at and personally write those things and make it yours, and certainly put it on your letterhead, and make sure that you print this out, staple the pages together, and tape it above your autoclave, wherever your autoclave is, if you have an autoclave. If you don't, then just completely ignore what I just said. So these are the types of things they look for. They also look for how you handle cold sterilization solutions, as well as ultrasonic solutions. And certainly if you're a dental office, you deal with ultrasonic solutions, and medical practices sometimes deal with cold sterilization. And that is, when you sterilize heat-sensitive items, and you want to make sure that you're disposing of these chemicals in a proper manner. Now, if you're using a glutaraldehyde-based cold sterilization solution, you need to purchase a neutralizing agent to neutralize the chemical before pouring it down the drain. There's several neutralizers in the market. Find the best one that you like and go ahead and purchase those, and make sure you are treating your chemical on site before pouring it down the drain. Otherwise, you will be in violation of the Waste Management Act and also from DTSC. So you need to be very careful about what you're pouring down the drain. If the item is acidic, if a chemical is acidic, such as some ultrasonic solutions, you might use baking soda to neutralize the acid before pouring it down the drain, and so on and so forth. They will also check for tracking documents from your waste company. So whoever's your waste company, when they pick up your waste, they leave you with a tracking document, which is proof they picked it up and they basically took and treated the waste properly. And that tracking document you should keep for at least 3 years in your records, okay? Now, the next agency is DTSC, or Department of Toxic Substances Control. And these guys are interested in how you handle your hazardous material. Now, if you don't have any hazardous materials in your facility, such as formaldehyde, glutaraldehyde, lead foils, or any type of lead or mercury waste, as well as X-ray solutions, then you really don't need to be concerned with this agency. Formaldehyde is definitely considered a hazardous material. Same with glutaraldehyde, mercury, and lead. So there's a list on their website that is called the Hazardous Materials List, and you can actually look up and see the chemicals that you use in your facility. Are they listed on that list or not? If they are, then you're going to deal with these guys. These guys also will issue you your EPA number, or Environmental Protection Agency number, which is a tracking number for any generator of hazardous material. If you don't produce hazardous material as a generator in your facility, then you don't deal with these guys and you do not need to have an EPA number, okay? Let's move on to the next agency, and that's Department of Transportation. Department of Transportation deals with packaging, labeling, storage, and shipping of these chemicals, or what we call regulated medical waste, as well as chemicals. So, DOT also is an important agency to keep in mind because they decide what goes into what container. So when you look at the list, you'll see that the first category is called contaminated sharps. Contaminated sharps in a medical facility would be needles, scalpel blades, maybe some suture needles and things like that. In dental offices, it's much more broader. We have needles, we have scalpel blades, we have suture needles, as well as burrs and endophiles. We have any orthodontic appliances, wires, brackets, screws, whatever. Any type of carpules that are used, those are considered contaminated sharps because you aspirate blood into them. They're not considered pure pharmaceuticals, they're contaminated sharps. And we actually make sure that all of these carpules are put into sharps containers. And you have two choices. One is you can express what's left in the carpule onto a paper towel and throw the empty carpule into the sharps container. Or if you don't want to do that, you can just throw the half full or half empty carpule into the sharps container. And then what you have to do is you have to label that particular sharps container as a pharmaceutical waste. And the label should say pharmaceutical waste for incineration only in all caps. And then that particular sharps container will have to be incinerated. Whereas if you emptied the carpule prior to disposal, then that sharps container can still be autoclaved. And that's very important for you to have that option, and here it is. And so the second category, if you look at this diagram here, is considered red bags, what we call autoclavable red bags. Now, the definition of red bags is any item contaminated with blood or other potentially infectious material that is capable of releasing the material during handling. Capable of releasing simply means when you're handling this particular material, it can release blood or any other bodily fluids that are considered infectious, okay? So that means, yeah, obviously if the gauze or whatever you're handling is soaked and saturated, that certainly is the case. But it doesn't always have to be soaked and saturated. It could be dried blood that is capable of releasing, like caked blood on something. Or it could also be enough blood on there, but if you get the item wet, it would release blood. So you have to make that determination as an individual employee, whether this is something that's considered red bag or not. And certainly you want to make that determination with utmost care, right? So the next category is pathological or microbiological waste. Now, if you're a dental office, that would mean extractions, okay? If you're a physician or a medical facility, that might be other things such as tissue or bone removed from a human source. Now, these pathological wastes are incinerable waste. That means they have to be incinerated, whereas red bags that are just bodily fluids, they can be autoclaved as a way of treatment. So if you have to incinerate something, then they can't sit around very long. So in California, all pathological waste must be removed within 1 week, unless they're refrigerated under 32 Celsius, and if they are, then you can keep them for 30 days. Now, red bags, on the other hand, can only sit around for 30 days, and if they are refrigerated under 32 degrees, then you can keep them for 90 days. But there's another rule in California that says if you produce more than 20 pounds of red bag or pathological waste within a week, then it reverts down to a weekly pickup, and so they can't sit around more than a week if they're 20 pounds or more. So these are some rules to keep in mind. As far as sharps containers are concerned, there is a fill line on sharps containers. And when it reaches the fill line, you have 7 days to get it out of the exam room or operatory into a storage area, which could be a bin or it could be a closet where you actually put your sharps there and you seal it, you put it away, and then you have 30 days to get it out of the facility. And so keep these in mind according to California Waste Management Act. The fourth category is pharmaceutical waste. These would be expired meds for the most part, but also half-used vials of medication. So if you drew some med from a vial of medication and you didn't need all of it, the rest of it is still sitting in the bottle, you need to take that vial and put it into your pharmaceutical waste, okay? If it's entirely empty, the entire material or the medication has been drawn out using a syringe, that empty vial or glass vial or whatever it is can be thrown into regular trash in a clinical area, okay? And that's important. And remember that all pharmaceuticals must be incinerated. And you can keep them around for as long as a year, usually. And you want to make sure that when it's full, somebody picks it up. And you can also utilize a mailback system to get rid of your pharmaceuticals. And if you have any questions about that, give us a call. The last category is hazardous materials. So again, we talked about hazardous materials such as formaldehyde, glutaraldehyde, lead, mercury, fixer, developer, which are X-ray solutions, as well as other things like formalin, xylene, methanol, and IPA in large quantities. Those are all considered hazardous material. If you have anything like that in your facility, you've got to find out how you're supposed to get rid of each one of those in a proper manner, because they're all treated differently. Some are incinerated, some are thrown into a landfill, some are recycled, so it just depends on what the treatment is. Now we come to the next agency, and that's the fire department, and their main focus is fire, earthquake, and emergency response. Fire, earthquake, and emergency response is something that you're familiar with, I'm sure. So they check for fire safety, earthquake safety in your facility, as well as they want to make sure you have a system and a protocol in place called your emergency protocol, which we've covered in another video. Please watch that, called Fire Prevention and Emergency Response. I'm not going to cover that at this point. Just remember that the fire department has jurisdiction over all those types of situations in your facility. Let's move to the next agency. And again, here, either you're a dental office or a medical facility, right? So if you're a dental office, you will be under the dental board. If you're a medical facility, you'll be under the medical board. So that means that you need to pay attention to what they focus on and what their requirements are. Their focus, as you know, is quality of care and licensing, right? Quality of care of whom? Patients. So focus is on patient safety. So when we talk about, for example, sterilization, we are talking about how to sterilize to keep patients from getting sick. When we talk about sterilization with Cal OSHA, we're concerned with employees' safety while sterilization is happening, which means what? What type of personal protective equipment should they be wearing, right? So the focus is a little bit different. So again, the dental board is concerned with a few things, such as making sure there are no expired medications sitting around in your emergency kit, first aid kit, or any carpules that are sitting around. They're going to want to see spore testing done on a weekly basis in California. In some other states, it's only monthly requirements, but California says weekly. And you need to keep 12 months of your records, 12 months past. The next thing that they are concerned about is having an eye wash station that is ANSI approved. That's American National Standards Institute. And that this particular eye wash station is available and accessible during business hours by everyone. So it can't be in an operatory. It has to be in an area where it's accessible, such as sterilization area or lab. And then they also want you to have certain items of safety in the facility, such as your emergency kit. You need to have your eye wash station, which I already mentioned. You need to have a portable oxygen supply for emergency use only, designated for that, cannot be attached to your nitrous, can be attached to different things or attached to the wall. It has to be freestanding in a cart or in a container, like a box or some kind of a carrying case. Then you need to have an ambu bag. And if you see adult patients and pediatric patients, you need to have 2-size masks for both. And you also have to have a first aid kit and a bodily fluid spill kit. And if you have hazardous material in your facility, then you have to have the appropriate chemical spill kit in your office. So these are the things you have to have. And if you do things like IV sedation, general anesthesia, or conscious sedation, then you need to have a much more extensive emergency kit than the basic 5 meds, which was epinephrine, nitroglycerin, albuterol inhaler, Benadryl injectable, and glucose. You need more than that. You need also an AED, automatic external defibrillator. And this is something that you need to pay attention to, because every time the board comes and inspects you, they're going to look for these things, including other people such as insurance companies that come and do audits. Okay, now if you're a physician or medical facility, the only thing you don't need to be so concerned about is spore testing if you don't have an autoclave. The rest of the things that I just mentioned with dental office will apply to you as well, and you need to have these things on hand. Additionally, the dental board requires a couple of new things that I like to mention. One is that they require now that inside the operatory, there'll be placed extra barriers, or what we call a secondary barrier inside the drawers, covering your disposable items such as cotton rolls or 2x2s or whatever you have in your drawers. That means when I open your drawer in an operatory, because of the presence of aerosolization, things will land on top of any disposable things that you have in the trays. So whatever trays you have inside the drawer, they need to have a cover on them. And whenever you want to get something during the procedure, you are to lift the lid up, straight up, reach in and grab something without lifting the whole thing away from the thumb. So to cover that area while you're picking something out of the tray. This is a new requirement. Well, actually it's not a new requirement, but it's now being really enforced. So the reason you need to have these secondary barriers inside the operatory of a dental office is because whenever a dentist or a dental hygienist use a high-speed handpiece in the patient's mouth, this actually creates what's called an aerosol. An aerosol, this is basically the saliva and whatever is in the mouth, blood, whatever in the mouth of a patient gets aerosolized, becomes like mist, and it lands on everything. Now, physicians usually don't have that happening in their facilities. That's why they're not required to have the secondary barrier inside their drawers, but dentists do. The next thing that they also require is that each and every clinical staff in a dental office and or a medical office who do any type of cleaning tasks, sterilization of any kind, these people have to have their own utility gloves, which are thicker gloves and designed to be more resistant to punctures and also chemicals. And one of the best ones are nitrile gloves, utility gloves. And you don't have to get the real thick ones. You can get the ones that are not so thick, so you have good dexterity still. And that basically is the last thing I want to talk about with regards to dental facilities. Now, medical facilities, you also have to provide utility gloves to your staff, as well as making sure that you have all the other items. And with that said, this concludes this section of the overview of regulatory compliance. Thank you so much for your time.